Hi, everybody. Welcome back to the Beauty Outlaw. Today, we're diving into the exciting world of peptides and oral supplements with Dr. Hayden Collier. He's the Director of Clinical Services at NuBioAge, a company bridging the gap between cutting-edge research and clinical practice. Dr. Collier will reveal today the essential peptides and supplements you need to know about for longevity, like BPC-157 with KPV, Methylene Blue, and their innovative product, one of them called iSell, we're going to dive into. I love that product. We'll also dig into the challenges of the growing industry and what makes NuBioAge a trusted name. Plus, you'll get the scoop on their upcoming summit they'll have this March in Florida. So stick around. This episode's going to change your approach to longevity, health, and wellness forever. I promise. I'm all about health, wellness, and beauty. Living well, looking great. That's what truly works. That's why I love to share my tools in the shed. And one of them is sauna space. I love sauna therapy. I do dry sauna, infrared, and red light sauna. That's why I'm obsessed with sauna space. I have one here and at home. This portable sauna combines infrared, red light, and dry heat using incandescent light bulbs, zero EMF exposure, and made with non-toxic materials. It's like basking in the sun, boosting heat shock proteins, energizing your body, and naturally detoxifying in just minutes. If you've been looking for a sauna, this is the one, guys. So go to the website now and get your exclusive 10% off code with Beauty Outlaw at checkout or via the link in the show notes. And thank you, Sauna Space, for helping us live well and feel amazing. Hi, Hayden.
Hi, Jerry.
I am so glad we've met before online, and it was so much fun. You were giving me advice on your wonderful products. One of them I love is the BPC-157, your Peptides.
Correct.
But we'll get into all those peptides in a minute. What I want to know is a little bit about you. So share your story. How did you become a pharmacist, and how did you end up with this amazing company?
Well, so I first started, in the pharmacy space. I worked at Walgreens as a technician, and then when I got accepted into pharmacy school as an intern, a pharmacist there, and so I was there, and I worked in my hometown. So it was great. All my patients I knew for many, many years, and I was happy for a little bit, but then unfortunately, just with everything how COVID hit, and then just the expectations of retail pharmacy in itself was overbearing, and it was really stressful. And luckily enough, I was able to get another retail job at a smaller chain called Winn-Dixie. They're more of a grocery store, so it wasn't.
Heard them.
Yeah, it's bigger in the Southeast. It wasn't as demanding as a retail pharmacy job. Still in my hometown, so it was great. Still knew a bunch of people, but it was funny enough. I had a patient who I've known for 10, 12 years. Was a mutual patient of Frank, who owns Progress Pharmacy, who works really closely with NuBioAge. And my patient came to me, he's like, hey, this guy's doing some really cool stuff. I think you would be a great fit over there. And I was like, I'll never turn down an opportunity. I'll go see what they have going on. And I met with Frank, and I was like, man, this is where I truly belong. I've always been in the health and wellness kind of space. I've been working out since I was like 14. So a little bit of gym bro stuff as well. But like in this kind of space, it kind of really merges together. Mm-hmm. And so I dove headfirst into all the education and stuff like that, and kind of never looked back.
That's awesome.
I've been here now almost 2 years, and it's been great. Luckily enough, I get to work with providers every day about what's working, what's not working. Go a lot over dosing, side effect contraindications, but how to truly implement a lot of these strategies into their practice. Because sometimes they'll go to these conferences and they learn about these things, but it's like then they have a lot of questions of how do you implement it on Monday morning. So we try to be that that bridge to help providers, be successful with a lot of these, supplement peptides, things like that, but then have, be safe as well. It's one of the biggest things that, we want to make sure that our patients are having good outcomes, but providers are doing it safely as well.
Now, you mentioned you grew up. Did you grow up in Florida then?
I did,
Where you're
yes.
at now. Mm-hmm. So that's your hometown?
My hometown. I've lived in, born and raised, native Floridian. I was born at Palm Beach Gardens Medical Center, and then I live in a town now called Loxahatchee, which is a little out west. And I live on a dirt road. I have
Oh,
chickens.
I love it.
Yeah, I live on an acre and a third. I have 3 little kids, so 3 boys, and we run around and play all day. So it's a lot of fun. It's a great place to grow up. So, I'm glad I'm still out there. But yeah, so I like lived out there my whole life, staple in the community.
And now you're blessed to do this amazing longevity supplement, get into peptides, and use what you love and you're so passionate about outside of mainstream medicine, which gives you just, I don't know, it's just, there's more excitement there. There's more to health, I think.
For sure. I mean, working in the pharmacy.
Sick system.
Yeah, because like I had patients that would continually come and see me, and they were never getting better, right? It was always like they were being maintained, and then we had to add a new medication on. We were never taking anything away. They were never truly getting better. It was just like throwing a Band-Aid on whatever they had going on. But now we get to truly help people. You truly see people succeed and get better, get healthy, and then even the healthy people that are coming in just getting optimized and feeling better, and being at their top peak performance is always fun as well.
We do things so backwards in mainstream medicine. We don't handle the problem starting, at the top. Like, for instance, you've probably seen some cases where you've seen people turn around and been able to get off some of their medications being in the space that you're in. Do you have a story? Do you have somebody that you know that's actually, there's been some things been able to change because they're doing oral supplements and peptides?
Yeah, for sure. I mean, there's plenty of stories, right? And I think in this space too, unfortunately, I think with a lot of gut health patients, our current healthcare system totally fails those patients, right? Because it's either steroid or some kind of biologic. And so a lot of patients looking for different options come to functional medicine providers, a lot of providers in the space. So, patients that either starting either lorazepam or the gut tides, things like that, have been able to get off, certain medications that were causing them a lot of side effects, and it totally changed their lives, right? Of course, lifestyle modifications, things like that, diet changes are also super important. But yeah, definitely, I mean, there's plenty of stories of patients getting off their, cholesterol medications, or even, losing a bunch of weight, getting off blood pressure medications as well. So it's definitely, a common theme, in this space for sure.
Well, a lot of things that you guys offer, actually, I really feel like they support people in the GLP-1 space and GIP space, so the trizepatide and the semaglutide space, because there's missing links there. And there are people that are resistant to these agonists or medications that help their insulin regain sensitivity and remove the resistance, but it doesn't address other things. You guys have some options for that, like oxytottin recommendation, right?
For sure, and that's what the biggest thing, right? These GLP-1s and GLP-1s work. If they're not working in patients, there's usually some other underlying condition or reason why they're not, right? Some inflammatory status, whether it be from stress and cortisol, like you're talking about oxytocin, whether it just be, unfortunately, obese patients and adipose tissue is pro-inflammatory. So it's like a perpetuating cycle of inflammation, which causes insulin resistance. And then, or gut health, right? Your gut is like 70% of your immune system. You have antigen trafficking, highly inflammatory particles being released if they have leaky gut, that's causing insulin resistance and causing metabolic issues. So we do have a bunch of things that that patients can use to kind of help negate that inflammatory status and help, like you said, with insulin resistance and regaining that insulin sensitivity for sure.
Can you talk about the gut tides?
For sure, yeah.
There you go. Get your cough out of the way.
So, BPC-157, it is a peptide that's derived from gastric juices. It's like 15 amino acid chain, and it's been shown to help when it comes to healing the epithelial layer of your gut. It also helps decrease some inflammatory markers, some inflammatory gene expression as well. So it helps healing and then decreasing that inflammatory status. And then KPV, which is another peptide, it's a 3 amino acid chain, but it helps inhibit tumor necrosis factor alpha, which is one of the main inflammatory cytokines that we see when it comes to gut issues. So just both of them working synergistically together does a great job at helping just repair any gut lining issues. It will help when it comes to gut permeability as well, just this overall gut function. It does a great job for a lot of patients.
To explain the difference a little bit between BPC being used as an injectable versus taking it orally.
For
Is
sure.
there-
Yeah. So, I mean, with the injections, I mean, the one thing that a lot of providers will use it more so in is like the soft tissue injury repair, because it has an effect on angiogenesis and when it comes to fibroblast migration and things like that. So with the injection, it does work really well for soft tissue injury repair. I mean, on the oral side, it does have some oral bioavailability. Like, we want that main effect in the gut. I will say on the soft tissue side, you probably have to do higher doses, and it's going to take longer than the injections will. But we do still see some benefit on the soft tissue side, but like the injections work much quicker, super beneficial. They use it a lot with, either BPC or pentadecapeptide for the injection side, with thymosin beta-4, which is another peptide that they'll use in combination with to help synergistically really help soft tissue injury repair, healing, and just promote overall wellness.
As a patient, because you guys have started an awesome company, what are some checks and balances when it comes to actually your purchase of a product like this? Because it's not FDA, it's not regulated by the government. This is a space that is not regulated, I assume.
Well, so when it comes to pharmacy, right, I would push back just a little bit, right?
Okay.
Pharmacy is like one of the most regulated industries out there, right?
I would agree.
There's the FDA, there's what's called USP, which is the United States Pharmacopoeia, when it comes to how things can be compounded. And then the state boards as well, regulate, they come in and inspect the pharmacies all the time, right? So
you guys are under a microscope for sure.
for sure. Then there's the DEA that also, comes in, and, for any controlled substances and things like that as well. So there's definitely a lot of different, and then of course the states have different laws as well. So you have to know, some things are classified as controlled substances in other states and some aren't. So it's like there's laws for all the states are different as well. So when it comes to, making sure that these items, like you said, technically they're not
Pharmaceutical
FDA.
grade is what you're looking for.
Yeah,
though.
USP. You want to make sure that the quality is there when it comes to the products is right. Because there are a lot of research chemical things out there, right? And that's what a lot of patients are going to. But unfortunately, those are the ones that aren't regulated. There's no jurisdiction, right? They say that they're tested, but like, how do you know that it's made in a clean and sterile environment?
Right.
Unfortunately, you have no assurances on that.
Right.
And unfortunately, when you talk about signing your life away, like, and not for human use, they make you sign off on all these things, and we definitely want to make sure that, when it comes from a pharmacy, it's going to have that quality assurance and making sure that it's a safe product.
So people should look for that, like pharmacy grade.
1,000%, yeah.
Because like you said, you can't, like so many other supplements, right? You can buy them on the internet, you can do this, but if it's not pharmacy grade.
USB pharmacy grade.
USB pharmacy grade.
Yeah, you want to make sure. And then like if it's coming from an FDA, inspected facility, right? CGMP, so the process that it's being made is safe, and that the FDA has inspected those facilities as well.
Talk to me about a few other of your peptides that you guys have to offer. You guys have these really unique names. Let's talk about iSell.
Okay, yeah. Well, iSell is probably my favorite one, right? I mean, so it has 5 grams of creatine, 5 grams of alanine, 4 grams of glycine, 3 grams of glutamine, and 3 grams of leucine. I mean, creatine is my favorite supplement. I've been taking it forever. But what really is special about it, right, when it comes to, and how we look at iCells, comes to cellular hydration. The creatine and those amino acids, they act as osmolytes to really bring water into the cell. Specifically, we see it mostly in muscle, but adipose tissue as well. And just keeping the cell in a hydrated and proliferated state. When that happens, the cell is hydrated, it's in a good volumized state, it inhibits protein degradation. So we see a lot used in patients who are on GLP-1s because, one, they're not eating enough protein, most aren't resistance training, and then also GLP-1s decrease thirst. So with that perfect storm there, that's why patients lose muscle. There's no direct mechanism. It's indirectly with all those things. So iSell, what it really does is it helps volumize the muscle, inhibits that protein degradation. I mean, we have patients that are on iSell and doing GLP-1s that gain muscle at the same time, right? So it's not a myth. It definitely happens.
Yeah. They
just have to be doing the correct things. So, I mean, we see it used. I mean, even if your patients aren't on GLP-1s, when it comes to exercise and performance, right? When it's extremely beneficial when you can have patients who have the same amount of muscle mass, but if some have higher intracellular waters, they actually will perform better. So when it comes to performance as well, it's super important, hydration. And what makes, iSell different from other like electrolytes and things like that. Like your electrolytes really cross that osmotic gradient really quickly, so you can have a quick influx, but also a quick outflux of electrolytes, right? So the amino acids in iSell, we recommend drinking throughout the day so that your muscle can stay in that volumized
So
state.
I know it comes in packets as it comes in packets and
We have a tub that you can
scoop up. And so it would be like one packet a day
Correct.
for someone and just sip it through the day.
Yeah, we usually recommend like 1.5 liters of water with ice. Just stays cold, because amino acids can degrade if it, over time. Like the alanine may have a little bit of a smell if it gets warm. So just keep it cold. And I know, I mean, I don't mind the taste. Some people don't like it, but you can put any kind of flavoring you want in there. You can put lemon, you can put a splash of Gatorade, other electrolytes, whatever. It's not going to harm the iCell, but I don't mind the taste, but some people don't.
This sounds like it would be wonderful even for our elderly population.
Preventing sarcopenia in our elderly patients. I mean, sometimes it's tough getting them to drink that much water.
Yeah. but they need to.
But they need to. In our POTS patients, it's been really beneficial as well. So it definitely has a wide, scope, for a lot of patients.
Okay, you have some other things that help with lipids.
We do. Probably Leonard's favorite.
Because everybody's on a statin in America.
Everyone's on a statin. And unfortunately, I mean, patients need to be on statins, right? But we haven't had any good options to replace them recently. So, but citronellol LNA, we believe, is what we call our statin replacement, right? So citronellol, it's a combination of nobelatin and tocotrienols. They're polymethylated flavones, and they work on similar pathways as statin, so HMG co-reductase, but instead of it being an inhibitor at that receptor side, the enzyme that breaks it down. But you don't get the elevated LTs, you don't get the myalgias, you don't get all the issues.
Side effects.
You don't get all the side effects that we see, right? It also has low doses of leucine that have shown to decrease the amount of nicotinic acid needed for that niacin dose, right? The normal niacin dose 1.5 grams, but you get a lot of flushing, you get headaches, and at the super high dosage, you might get some hyperglycemia as well, but you only need 75 milligrams of nicotinic acid to get the same cardiometabolic effects. So some patients who are really sensitive to niacin will still get the flushing. I happen to be one of those people. I break out bright red, but most people don't, right? And but what we've seen some traumatic effects when it comes to decreasing LDL and ApoB. I mean, I dropped my LDL by like 30-40% in 2 months, right? So it's extremely beneficial. And, like I said, we think can be a great replacement and alternative for a lot of people who, of course, if they've had a primary event, they need to be on a statin. But for patients who maybe they're, the total cholesterol or the LDL is shooting up there and we want to be preventative, citronellol is a great option for those patients.
Is this something you believe people should have a provider to help walk them through?
Oh, 1,000%, right?
Okay.
Yeah.
That's
we
where you
want
guys
to make
are coming
sure,
from.
Yeah, we want our patients to, we don't sell our supplements to patients. We sell them to providers. So we want to make sure, we believe, and that's what a lot of companies are doing now.
That's what I mean. For people watching this right now, they're looking you guys up. You're going to need to find a provider.
A lot of companies are bypassing the providers when it comes to longevity now. They're just trying to skip them, right? It's like we're going direct to consumer, and we don't believe that way at all. We know the providers are an integral part of patients' care, and we want to be making sure they're managed correctly.
And that's what you guys have so beautifully done. There's something called a nucleus.
Correct.
That you have once you're
registered.
Once you're registered with your company, which we are. Me and Dr. Karen and I are registered with you all, and the education you give to a provider. I mean, as a patient, that provider is in really good hands because they have really good support to help guide you as a patient.
For sure.
And we can call you guys at any time,
you can,
which is so wonderful, and bug you
That's fine.
and get guidance for our patients. And this is really exciting. And you guys also have a longevity summit.
We do.
That you're called CALM?
It is, correct.
Am I correct? And
Yes,
what does
ma'am.
that stand for?
Clinical Applications of Longevity Medicine.
And that's in Florida.
That's going to be in Florida. So we're bringing who we believe the top minds in longevity and are going to go over all that aspects of like diagnostics, right? Treatments available, different kind of testing machines, things like that. Like everything that we think that you need to know to be able to, one, implement it on Monday, but also start a successful longevity practice.
Because that's really the future.
It really
that's where
is,
the next 5-10 years is going, and it's already here. It's just not enough people have the resources and the education to implement it.
For
and
sure.
This is fantastic.
Because we have more patients coming in, right, that are healthy, but they're like, one, they want to be optimized, and it's about that quality of life too, but then being able to identify risk in those patients to prevent that onset of chronic disease even later and later, to be able to, because longevity is not just living longer, but living better, right? So we want to make sure that we can help our patients live better and identify those things. So we're going to be talking about genomics. We're going to be talking about advanced labs like Clearly and things like that. So this is going to be a great...
Clearly, if I'm correct, is this an imaging, like an AI imaging?
Correct. For CCC angiograms,
It's pretty amazing.
It is very amazing.
I actually was going to have it done this past summer. I have not done that yet. I was going to have a CAT scan with the iodine and have it read by the AI scan to see the different layers of plaques. My
see
different
how hot,
how it acts. So if it's really what type of molecule, my LDL molecules, small, moderate, and large, really what is really there. And this is fantastic because people need the large molecules; those are going to be good. But the small molecules are the ones that are dangerous, so they can really get in there. I'm assuming and see all this. Am I correct?
So it kind of has to do with like what they say is like hot plaque or soft plaque, and which one's hard, right? The hard plaque isn't the danger. It's the soft plaque that's hot, like what they consider hot, has that opportunity to break off and then cause issues, right? So it's able to look at it, to analyze it all in your arteries and determine, how high a risk you're at, essentially.
And it also is in the space of orthopedics. They're doing this for shoulders and being able to see if it's a legitimate tear and things like that. It's pretty cool.
That's cool. Yeah,
it's pretty
awesome.
cool.
That's awesome.
I learned that in the sauna at the gym.
Nice.
A professional athlete told me that they were using this technology in Europe for orthopedics. So now I've got the cough.
Yeah.
What are we doing here? We're giving each other a cough. Why don't we do this? We'll clip this part and we'll just both cough.
Water, yes. Thank you.
Thank you. Yeah, I don't know where that came from.
And what's so dry here, just anytime I come to the West Coast, I get tore up. Like my sinuses, everything is just like.
You can keep your water.
Do you want to keep it here?
I'm good now.
Okay.
All right, boys, we're back. All right.
That was a commercial break.
That was a commercial break. We both had to cough. So we were talking about advanced technologies, and you were talking about Clearly and some other things that are going on in the space. I'm super excited about. I love that you guys are bringing this knowledge and education into a space where it's needed. My space, which is aesthetics, which in aesthetics, it's separate than longevity. They don't know anything about that space, and they really need to learn about it. And you've got this platform for us where you can have just unlimited knowledge a lot of knowledge. Like, when I was like, I have to take it in limited doses because it's so much and it's so awesome. And if you can't get through it in one of your videos, you can get you online.
Yeah, you can, for sure.
And you can help walk through the patient case. So if you have a patient with an issue and you're just not sure how to really break it down.
Some ideas about it, something that, just think as a pharmacist, sometimes I think about things differently than providers do, and it's always good, right? And then I learn from the providers as well how they're thinking about things. But we talk about aesthetics. A lot of aesthetics practices are moving into longevity and wellness because one, you can amplify the effects and increase healing and increase effects of the aesthetics procedures by using some of these peptides and things like that. And also you're able to help your patients not just look good, but also feel good, and then what that kind of looks like of just being able to bridge that gap between, aesthetics and a wellness practice. And that's what a lot of providers are moving towards.
Which peptide, oral peptide that you guys, or supplement that you guys recommend or have on your list is best for skin integrity and health? Collagen.
Yeah, the collagen's really good. I mean, iSell as well when it comes to hydration,
That's what I was thinking.
Yeah, so I've had some practitioners who use iSell and then maybe some of the other injectable peptides before and after procedures, like mainly like non-invasive skin tightening. and getting like some great results, from using iSell plus a couple other things.
Can I bring up something that I think if we could debunk a myth, or you can straighten it out, our oral peptides when it comes to the GLP-1 space, those don't work the same in the gut as they do when you inject them. Am I correct?
So, I mean, it's just the bioavailability is just so poor, right?
Okay.
That's the biggest issue with it. So even when looking at commercial available drugs like Rybelsus compared to Ozempic or
Yes.
Wegovy, the doses is so much higher. We're talking about 0.25 milligrams up to like 16 milligrams of Rybelsus. And even when you look at the studies, there's not the same dramatic weight loss that we see in Rybelsus compared to Ozempic or Wegovy. So, I mean, there are some, being working in the compounding pharmacy space, there are some bases and some things that you can use to help increase that oral bioavailability. Is it going to be as much as the injection? No, the injection is going to be the most efficacious. But, there are some options for patients if they're just totally needle shy. There are some things, but it's not going to work as well, right?
Okay.
The injections are just going to be, unfortunately, the
They're far
peptides are so
superior.
fragile, they just get broken down in the gut, and the bioavailability is just so low. That's why you may see some things that either like sublingual or some dissolvable tablets and things like that. Yeah, that will help. The mucosal barrier in your mouth can absorb some of those peptides, but you're probably going to have to dose them much more frequently than doing a once a week injection.
Okay. So I know that some people have come out with oral GLP-1s that they're selling online. Probably not a good idea.
I mean, it's not that it's not. It's just definitely, I think, unfortunately, the telemedicine space has kind of taken it over. And we talk about, like, you truly need that relationship with the provider. So if there is an issue or it's not working, you can talk to a provider about it. And in that telemedicine space, sometimes there's a gap between that connection and that accessibility to providers about, hey, I'm having an issue or it's not working. What else can I do? Or, so... I mean, it's definitely, there's a lot of companies that are promoting it online and it may be beneficial for some patients, but, I truly like that closeness that, sometimes that can't be offered through telemedicine.
Yeah. Yeah. So what are you guys going to be doing coming up this weekend? Now you're here.
Correct.
And he's visiting, you're in LA right now.
Correct.
Because you guys are filming some courses.
Correct.
For your Nucleus, right? Your educational platform, or for everything with NuBioAge? Informational videos and...
Yeah, some informational videos, and then also we're going to be coming out with a longevity certification course.
Oh,
so besides...
that's cool.
Yeah, so we're going to be... We're filming for that. We are going to be in... I leave today for Vegas. We're going to A4M Longevity Fest, which is a great event. A lot of practitioners in our space are going to be there. A lot of vendors. Other companies in the space. So it's a fun time. It's a long days, but it is a lot of fun.
Will you guys be speaking up there too? Do you?
Leonard has two. Yeah, he's speaking. He's going to be doing a metabolic breath analysis talk on Saturday, and then on Friday at like 11:30, he's doing another talk on some peptides and supplements.
Okay, so what's this breath analysis? Metabolic breath analysis test.
So there's a company called Panoe. They have a metabolic breath analysis machine, and we can do VO2 max testing. We can do resting metabolic rate testing. So we actually have a metabolic assessment center in Florida where we have a DEXA scan. And we have a Panoe, so we do VO2 max testing.
Great. Everybody needs a DEXA scan.
The DEXA scan, it is, it is humbling though. Like they tell you what, we do have some of the body, like the electrical impedance machines, right? The body comp machines, and someone will get on one of those, and unfortunately, there's a certain subset of patients, right? They're thinner, but they don't hit the gym. The electrical impedance machines will say they're like 8, 9, 10% body fat, but they get on a DEXA and they're like 20, right? And they're like, what, So it's definitely, the DEXA doesn't lie, right? And it doesn't, it's much more accurate when I believe when it comes to, finding that fat that's in your muscles, like almost like marbling, because it really is able to penetrate that. So it definitely is, for those people that are thinner, so it doesn't take that much more fat, mass to really shoot up their body
These
fat
are things
percentages.
that people want to do too to optimize, like in the performance space, I assume.
Oh,
right?
for sure, yeah. So the VO2 max testing
Yeah,
is,
definitely a
performance thing when it comes to your
You're not putting my
cardiovascular
dad
fitness.
on that.
I mean, we can.
You could, yeah.
You can. And that's the thing, right? So even if you're like, for our older patients who do maybe want to see where their health is at, and when it comes to, even if you're doing small changes in their VO2 max, can be a big incremental, like, decrease in their absolute risk, almost compared to like certain other diseases like chronic kidney disease or even smoking, right? Just small changes of your VO2 max, especially when you're older, can be a big,
huge.
It can be a huge difference.
Huge difference.
And then even when our patients are on GLP-1s doing like resting metabolic rates, you can see what their total energy expenditure is. You can see what they're using as a fuel source at rest, usually in a fasted state. So like, it's always funny when patients come in and I'm like, oh, how's your diet? No, it's good. And then like they're fasted, but then you can see their carb to fat ratio, they're burning so much more carbs. And it's like, well, either your diet isn't good, or like, well, what'd you have for dinner last? Oh, I had a huge pizza. And it's like, okay, so
the truth comes out.
Yeah, the truth comes out for sure. And then there are some cases where we see where patients either getting over COVID specifically, where their mitochondria function is totally out of whack, right? And even if they are eating well and dieting, but you can see that their cells aren't going through oxidative phosphorylation; they're only going through glycolysis, so they're burning much more carbs. And and then there's some treatments and things that you can do, and then test them a couple weeks later, and then it comes back to normal. So it is tough though, because it's only in that 10-minute window, but sometimes you can make some pretty remarkable findings from it. It is definitely pretty cool.
That's really exciting. I love all this. Another question a lot of people have, and the new thing with people walking around with blue mouths, with a methane blue.
Yes.
Can you explain that to the listeners a little bit?
Yeah, so,
what it is and how it works?
So methylene blue actually originally, it used to be a textile dye. But back in the lab,
right? We use that in the lab when we look underneath the microscope.
Well, that's how essentially it first started getting its medical use in like 1876. They, a provider was looking at it and he saw that it turned like neurons, live neurons blue, and then they were able, for malaria treatments is what they started using it for, and so but what it really does that we love is it has that redox capacity and as an electron donor and receiver in the electron transport chain. So we see that a lot of patients that, even though they're healthy, but they're sedentary compared to healthy patients who are active, they have even mitochondrial dysfunction at complex 1 and 2. So what it does is it helps bypass that. So you don't have to donate from NADH. You go straight to cytochrome C. The methylene blue can donate the electron there and, help the mitochondria produce ATP. So
energy, guys.
Energy. So when since it's lipophilic and hydrophilic, it passes the blood-brain barrier. So you get those benefits in the brain, and that's where we get a lot of mitochondrial dysfunction in the brain, which cause Alzheimer's disease, Parkinson's disease, a lot of neurodegenerative diseases. So it's been exciting research coming out with all the applications there. But talking about blue mouse. This the biggest thing when it comes to getting methylene blue online. We talked about USP, right? Mm-hmm. So with methylene blue, it's super important to make sure wherever you're getting it from is pharmaceutical grade, because FCC grade, which is food grade, which they can put in some of these things, does have a much higher level of impurities, and these impurities are like lead, arsenic,
the things you're trying to not use.
Exactly, right? This can be really detrimental to patients. So. Just make sure wherever you're getting it from, like you said, and then if you can ask them like, hey, do you have a C of A, right? Certificate of analysis. I want to make sure that whatever you're getting is what it says it is.
Did you guys hear that? Certificate of analysis.
Ask for a C of A. They should be able to show that to you wherever they're getting it from. And that's where we generally recommend to get it from a pharmacy, not to get it online, because sometimes, they say it's USP and then you ask them for it and they don't have those things. So it's always good to make sure,
A lot of people are just doing they're getting it online. They're ordering it because they hear about it. Mm-hmm. They're not having someone guide them through the process that understands it, like a provider.
Exactly.
And make sure their source is good. Now with methane blue, is there a delivery system that's best?
Well, I mean,
in the body.
So the oral one has great oral bioavailability and tissue absorption, right? It's not that, I mean, we do have IV, you're able to do Methylene Blue IVs as well. But I mean, honestly, I think in practice, I think we see just as good as results with the oral one. It doesn't have to be a troche sublingual, but
Okay,
it can
just
take
take
it as a capsule. Blue urine will be seen. So like, if you start
Be
taking it,
prepared.
be prepared for sure. That's definitely common. And, another adjunctive therapy that's great is to do red light therapy along Methylene Blue. So red light therapy helps.
ATP, baby.
It helps increase that cytochrome C activity. So it just makes, your cytochrome C pulling electrons from Methylene Blue that much better. And like some patients who do Methylene Blue with red light, their urine may not be blue because the reduced form of Methylene Blue, glucomethylene blue, is clear. So it means your body's just really utilizing the Methylene Blue. And that's why, like, sometimes it may be clear, sometimes it may be blue. But if you're
Methylene Blue, it crosses the blood-brain barrier?
correct, yeah.
Okay, that's why it's so helpful
That's
to
why
the brain.
into the brain, yeah.
Lights up the brain. Wow. Just like near red light.
Near red light, and then we also get some increases in BDNF, so brain-derived neurotrophic factor as well. And that's where we get some of that cognitive improvement as well. So if you've taken Methylene Blue, you can it's not like a stimulant kind of focus, but, just, I don't know, it's kind of hard to explain unless you've taken it, right? You see improvements in focus, but not stimulant-like.
What about for the treatment of Alzheimer's and Parkinson's and things like that? Have you heard any? Has there been any studies?
Yeah,
on that?
yeah, there has been plenty of studies on it, right? And the biggest thing is that for Alzheimer's in particular, doing around.
I know red light has made a significant impact in that.
For sure. And then they use red light and Methylene Blue together for COVID patients, and then it kept patients out of the ICU, and it helped. It was fantastic because it has some antiviral properties as well. But for Alzheimer's disease, there's some. When it comes to dosing, the studies are kind of all over the place. Some do higher. 60 milligrams 3 times a day. There was another one doing like 18 milligrams 2 to 3 times a day. But they still saw benefit even at the lower doses. And what they saw is that it stops the progression of the disease, right? It's not going to it's not going to reduce the beta amyloids that are already there. It just helps prevent tau migration and formation and helps the tau microtubules from being dissolved.
Then why aren't we giving this to everybody?
So that's what when it comes to being able to identify risk in patients, doing genomics on them, say, hey, you're at really high risk of Alzheimer's, right? Maybe doing something like Methylene Blue and DEXA would be extremely beneficial in preventing neurodegenerative disease. It's something that a provider can help walk you through. And
so amazing. It truly is. Methylene Blue, like you said, 1800s, and they were giving it for malaria to get rid of malaria. And was it on the list of the WHO's most safest drug or something?
I mean,
at one point in time,
it definitely it could have been. I mean, they use it for septic shock, like vasopressin. They use it for. They use it in the hospital all the time. And it's funny when we do have providers coming into the space, they're like, "Oh, methylene, what?" I mean, they remember pushing it in the ER and the ICU, and it's like it's we call it's hormetic effects, so dose dependent effects, right? At much lower doses, we don't see the same effects that it has at the much higher doses when they use it for certain things.
So it's definitely something that you'd probably be taking a couple times a day. What are the side effects? Are there any things like is it usually gut issues, or do you just feel a little?
No, so I mean, and again,
do you get red? Is there any
no?
flushing?
It's pretty well tolerated, I will say. And this is one reason why, if you're taking Methylene Blue, I recommend being consulted by a provider because it does have some serotonergic effects, right? So anything over at higher doses, it can have
SSRIs.
Anyone that's on SSRI or on any kind of MOAs, you need to make sure that they're being consulted by a provider, right? Because you could do these things, and unfortunately, I haven't seen it in practice yet, but theoretically, serotonin syndrome can happen, right? Especially if you're doing at much higher doses, you're on other medications at the same time. It's something that can be a concern. Also, at higher doses orally, there were some studies and concerns about it decreasing bifidus bacteria. Haven't seen a lot of literature on it in particular, so that's why we generally recommend lower doses as well. Around that 10 milligrams twice a day, up to 25 milligrams twice a day for and if our patients are generally healthy, right, which most of the patients are, we recommend 2 to 3 months and then to take a break from it, because too much redux might cause hemolysis issues over time. So it's always good sometimes to take a break.
Yeah, with any of these peptides, a nice little holiday will help
sure.
fire them up again, right? Your body will just, it's an amazing thing. Your body just kind of will get used to what you give it.
Yeah, exactly. That second time around, it kind of knows. I know what to do with this, right?
I know what to do.
I remember. So yeah, definitely pretty cool.
It's in our space, the aesthetic space, the closest thing I can relate to that would be a neuromodulator. So a botulism type A. The body knows how to regrow those neurofibers back once it's lost them the first time. So when you go back with another,
it works that much better.
It works less actually. Well, it works better, but the effects don't last as long because the body knows how to respond to the toxin. So we do have amazing bodies, and I'm so excited about the longevity space. I've personally been in it a long time, and I'm excited that it's growing, and I'm excited for what you guys are offering, even beyond the supplement part. You're offering this whole educational side for providers, and it'll make it safer for patients.
Yeah,
and hopefully we get better clinical trials out of these things, and we get some more open-mindedness in the sick space.
For sure. Like you said, because longevity is like the biggest thing is preventing that onset of chronic disease and being able to identify risk in patients. And that's where we really want to help make a difference, because we see that's, like you said, the future of medicine. Because people are coming in younger and younger and trying to making sure that they're going to be healthy for a longer period of time.
They're dealing with their sick parents. They have these, watching them have Parkinson's and Alzheimer's, and it's scary. And so they want to do something, anything that they can do to stall that or delay it or have it not happen. So besides lifting heavy weights and getting in the sunshine, peptides are another great resource.
Great option. Lifting heavy weights, that's definitely one of my favorite things to do as well.
And it's
but
one of the number one things you can do.
Right?
It's better than being on a treadmill for 45 minutes. I'm not saying not to do that. I'm saying lift heavy stuff.
Yeah, exactly. More so than running on a treadmill. But when it comes, we call, muscle the currency to longevity, right? Like being able to not be sarcopenic and be frail and, live a healthy life. Muscle's super important.
It's super important. It's one of the only exercises, and I've done them all. I've been an exercise junkie my whole life. I've done them all. Cycling, running, marathon, I've done it all. Heavy lifting is the only thing that I've found that gives me mobility in every aspect, whether I'm doing biceps, triceps, overheads, pull-ups, squats. I'm moving my body in so many different positions. And so my goal is that when I am 80 years old, I can get up off the ground without grabbing onto a table and being unstable. So, and the muscles are going to help me do that.
That's right. They will.
So thank you so much
You're
for
welcome.
Being here. You took the time to come down.
No, it was
on
great.
Your drive.
I'm lucky you guys were able to fit me in. I was like, I know I'm only going to be here for 3 days. It was a pleasure. It was a lot of fun.
A lot of fun. I love you guys. I love what you guys are doing. And I'm so glad that you guys are going to lead the way for me too with all this education. So if you're a provider, you must check out NuBioAge. Go to their website. You can see their providers. You can apply quickly in the provider area. The application, you register. The application's really quick. And then I think it's more verification. And then you can get on and get all this great nucleus course information. It is a lot. So, and you also get Hayden at your access anytime, right, Hayden?
That's right. I'm available to help you guys with whatever you need.
So thank you again for everybody for joining the Beauty Outlaw. And this is my favorite topic ever, longevity. So thank you.
I'm sure I'll be back.
You will be. Yes. I'm going to have you come back. We always do a toast at the end of the Beauty Outlaw. So again, here we're talking about all these healthy things we should be doing. And we're going to end the day with the oldest. Well, we can just look at this as fermented grapes.
There you go.
Fermentation is good for the body too. So chin chin, Hayden. Thank you. See you guys on the next episode of the Beauty Outlaw.